We're back with the latest on the battle against the monkeypox virus. Cases continue to rise across the country, with here in New York City as the epicenter of the nation's outbreak. According to the CDC, the city accounts for more than 30% of U.S. monkeypox cases. Officials are trying to fight the virus head-on, opening 3 mass vaccination sites, and another clinic is expected to open soon. NBC News correspondent Antonia Hylton joins us now with the latest from one of those vaccination centers. She's here in Manhattan. Antonia, good morning. Now, one of the big issues we've been hearing about with monkeypox was a lack of vaccine supply. So what's the latest with that? Do these sites have what they need?
That's right, Savannah. To paint a picture for you, on Friday evening, the city made available 9,200 slots for first shots of the monkeypox vaccine. And that went live at 6 p.m. By 6:07, every slot was gone. And consistently, people who have been trying to get access to this vaccine have described the attempt and the website portals in order to get slots for these vaccine shots like something like the Hunger Games. So there's immense need here, and health officials say that in the coming days and weeks, they want tens of thousands more vaccines here on the ground, and they say it's really urgent here, not just in New York, which is the epicenter, but around the country. Take a listen to the New York City Health Commissioner describing the need here.
We need tens of thousands of doses. We're still working on the total number we think we need, but we've gotten a total of about 20,000 vaccines from the federal government to date, and we need much, much more than that. I think tens of thousands more, yeah. We need significantly more vaccine than we've gotten, and this will be a process that will take weeks to get all the people. If we get the supply that we need, it'll take weeks to get shots into arms.
Because the need here is so severe, Savannah, right now they are focused on getting first shots into as many arms as possible, even though this is a 2-shot regimen. This has some health officials a little nervous because 2 shots is what really gives people the full protection against this virus. But right now, as health officials scramble to get ahead of a virus that frankly got its foothold in New York before the testing and vaccination infrastructure was ready, they feel they need to focus on just getting as many first shots into people as they can, Savannah.
And Antonia, how are they prioritizing who is getting that first round?
Well, right now, eligibility is severely restricted, and it's focused on men who have sex with men, bi, transgender people, people who have anonymous or multiple sexual partners. And the reason that they're focused on that group of individuals is just because that's where the outbreak started. I want to be really clear that this is not a sexually transmitted disease. It's a disease that can spread to anyone with close contacts. And so certainly, even if you don't fit that initial eligibility guideline, you should be reaching out to health officials or to your PCP if you feel that you've had close contact with someone who has monkeypox, or that you have concerns for your own health for whatever reason. Again, it started in this community, and because there's restricted supply, they need to focus on getting shots into those arms. But there is no reason why other folks in New York shouldn't be on high alert right now and paying great attention, because this is a disease that can spread to anyone, Savannah.
And Antonia, of course, we just went through a massive vaccine rollout with COVID-19, and New York was the epicenter then. We had to learn a lot of lessons. Anything we're taking from that here with monkeypox that we learned?
Well, a lot of the lessons learned here in New York City focus around equity. And equity is something that's really challenging to accomplish when you are in a situation of scarcity. There aren't that many resources. People are scrambling. New York has also had technical issues with the website where they have been doling out the appointments. And so equity has been difficult to accomplish, but it has been front of mind. The way that New York has tackled this so far is by making sure that they're setting up clinics for these vaccines in every single one of the boroughs. Here in Chelsea, this site where I am today was the very first site. And while Chelsea is known as a more upscale neighborhood in Manhattan, it also is where so many, a large portion of the cases have come from. And so they really wanted to get in there, get the vaccine very locally available to those who would need it first. But they are making sure that that infrastructure spreads around the city. Take a listen again to the health commissioner here.
While doing this, we're also really focusing on equity, so making sure that we're putting enough shots in arms quickly, while also ensuring that we're getting enough vaccine out to communities that are hardest to reach. One of the biggest lessons from COVID was how important it is to build that in from the beginning. and to ensure that we're reaching the hardest to reach communities from the beginning of our vaccination campaign.
Despite all those efforts, when you talk to people who've been on the ground at these vaccination sites, they say it's been incredibly difficult, that at times people who know someone who works in the health department or who just happen to be on the website at the right time have been able to get those shots and those appointments. And so the city is actively trying right now to make sure that the process of actually booking these appointments for the people who need them is more equitable and more easily accessible. Savannah.
All right, Antonia Hylton, thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.